Hi, good afternoon, good evening, nurses. We're back again for another nursing Q&A and review. So we have a couple of questions prepared for you. First, we have a question here. A client with atrial fibrillation who is receiving a maintenance therapy of warfarin sodium has a prothrombin time or PT of 35 seconds and an international normalized ratio or INR of 3.5. On the basis of these laboratory values, the nurse anticipates which prescription. Number 1, adding a dose of heparin sodium. Number 2, holding the next dose of warfarin. Number 3, increasing the next dose of warfarin. Or 4, administering the next dose of warfarin. So in this kind of question, the question is actually asking if you know first the normal levels of these laboratories, prothrombin time and INR, what is atrial fibrillation, and then what does warfarin therapy or what does warfarin do to our body, what are the risks and whatnot. So first, let's learn what is atrial fibrillation in just a quick quick explanations. Atrial fibrillation is a type of heart or arrhythmia or dysrhythmia, wherein instead of the atria pumping blood, what happens is it's just quivering. So quivering, so technically if it's just quivering, it might not be able to pump the blood fully, and if the blood is not pumped, there's a tendency that it's in stasis, or it will just congest and in stasis, it's not moving. We know that if blood is not moving, it can cause clots, and therefore we have the warfarin therapy. Warfarin is an anticoagulant. It prevents clots, therefore that is really the main therapy or the main medication that is used for atrial fibrillations and diseases that can actually produce or has higher risks of creating clots. But of course, there is a normal value for prothrombin time. Prothrombin time is one that we measure whenever we're taking warfarin therapy. And the normal prothrombin time for a normal person is 11 to 12.5 seconds, and it's supposed to go up by 1.5 to 2 times when you are taking warfarin. So if you're going to multiply it, then we're expecting about 22 to 25 seconds prothrombin time. For the patient, we have 35 seconds, and it's too high, and it's already giving the patient a risk for bleeding. And therefore, what we're going to do, are we going to increase the dose? Are we going to hold the next dose? And adding the dose for another anticoagulant like heparin, or administer the next dose? We should hold the next dose of warfarin because there's high risk of bleeding. That's question number 1.